Hello dear colleagues and friends, my name is Viktor Scherbakov and this is my first clinical case with detailed comments. This video demonstrates the clinical case of composite restoration of a class 4 incisor defect. And as you can see here, I face with quite complicated structure of the cutting third. Such optical features, which we can compare with some amber effect, appear because of the high level of abrasion. And of course, the main issue here is the concrete formulation of shades and the combination. And I can honestly confess here that in the very beginning of the treatment process, I didn't have any particular decisions about shades, and all what I did next was an experiment for me to some extent. Here you can see the view after preparation and isolation stages, and also after sandblasting of dental tissues with powder of aluminum oxide with particle size of 27 microns. And I strongly recommend you to use sandblasting of dental tissues because these kind of influence may lead to the arising of many positive features and can really help us to intensify the force of adhesive connection. So here you can see the stage of adhesive preparing. The application of acid gel is the first step. My favorite acid gel is the so-called Ultra Edge from Ultradent company. This particular acid gel has a specific chemical structure, much more preferable for our purposes, and the efficiency of the etching with using of this kind of acid gel is much more higher. So usually I use method of dynamic etching. I just take some brush and start mix the gel on dental tissues, and this particular approach can lead to the increasing of micro roundness quality. This stage of washing off the acid gel with water. So then I remove all water excesses with the reverse flow of air through the salivary ejector. So here you can see the stage of ethanol application. Usually I use for all my cases ethanol bonding protocol with using of ethanol of 96%. And as you can see here, I apply some amount of ethanol directly on dental tissues. The exposure time of ethanol on dentin around 30-40 seconds. The stage of application of adhesive system. I prefer OptiBond EFL of the fourth generation, and here you can see the applying of the first bottle, the primer for dentin. Usually I apply primer for a few times with a thorough mechanical activating with a micro brush, just in order to form more deep hybrid layer on dental tissues. Thorough drying of the surface with a powerful flow of a clean air. And only then I apply hydrophobic filled resin or just second bottle from OptiBond EFL. Polymerization. In this clinical case, I work in method of Palatine silicon index, and this index was made in the very beginning from initial shape of incisor because its shape was absolutely good. As for material for Peloton wall reproducing, in this case I used OBN shade from Enamel Plus lineup. This material has absolutely unique and beautiful optical features and looks really nice, but it has only one drawback: its consistency, which is absolutely unbearable. Adaptation of Peloton wall and Peloton index to its original place, and removing of some irregularities of the surface, correction of shape and thickness of Peloton wall. The composite constantly sticks to the surface of instrument, and the process of modeling becomes absolutely uncomfortable. And the only way how can we overcome the disadvantages of this material is to use a paintbrush with some amount of modeling resin. But it works to fight with imperfections of this material, because if we will be able to subdue this obstinate material itself, we will disclose all of its internal beauty. Preventing the possible question, I never cover the surface of silicon index with some liquids or another agents before applying of composite. So then I decided to reproduce some amount of dentin core inside the restoration with the Ceramics Duo D3. Usually I use for adaptation and modeling of the composite material instruments from LMR to set. And also very often, as you can see, I use micro brush with some amount of modeling wetting resin. And I'd like to mention in the very beginning that there is nothing bad in using of wetting resin at the stage of modeling and applying of composite, even between the layers, even inside restoration. But you need to understand that you can use only special kinds of modeling hydrophobic resin which was developed directly for composite restoration. And it is strictly prohibited to use as one of the alternative uh, agents any kinds of adhesive system of the 5th, 6th, and 7th generation. Another portion of ceramics duo D3. Here you can see the stage of sidewall reproducing, and in order to avoid the sticking with the nearby tooth, I adjust sectional matrix for distal teeth right between central and lateral incisors. In order to fix the matrix better, I use the wedge, the same material as for Peloton wall reproducing, OBN from Enamel Plus. The continuation of dentin core reproducing with ceramics D3. I prefer to use ceramics duo D3 or D2 shades for dentin core reproducing in almost all my cases, because this kind of material and this kind of shades has absolutely controllable opacity, not too high, and after applying of all the rest layers, dentin core will look not too intense and not too saturated. This stage is applying of the first layer for reproducing of amber area in the cutting edge, and for this aim I used a Polisson Amber special shade from Enamel Plus lineup. Then a little bit more Ceramics Duo D3 for increasing of distal area of dentin core. Just a small non-transparent stripe made from Ceramics Duo D2 in order to reproduce the effect of hypermineralized dentin on the cutting edge. For body layer reproducing, I used Ceramics SphereTech A1 in this particular case. Ceramics SphereTech has its own specific optical features that I can describe as universal optical density and universal degree of transparency. And this material has very good chameleon effect too. And all these factors lead to the very high degree and very good degree of integrity into the complex of dental tissues. In order to fill this slit-like gap between dentin core and distal side wall, I used Estelite Color Clear. This is some kind of flowable translucent composite, which perfectly fits to the elimination of such slit-like gaps. And at this point I realized that the difference between opacity of dentin core and dentin tissues itself is too high. And in order to make such difference smaller, I decided to apply some additional volume of Ceramics Duo D3 in the area of junction between dentin core and dental tissues near the medial angle of cutting edge. And this is the second layer for reproducing of amber area on the cutting edge. And as I said before, it was a little experiment for me too. And in order to achieve this aim, I took two different materials, two different shades from different brands. So I took a Palestine Amber OA from Enamel Plus lineup, and I took D2 of Ceramics Duo, and I mix it up in a homogeneous mass in the ratio 80 to 20%. 80% of Enamel Plus OA and 20% of D2 Ceramics Duo. One more layer of body shades, Ceramics Sphere Tech A1. I'd like to say a few words about paintbrushes. Usually I use paintbrushes which I buy in ordinary art shop. I prefer brushes made of a synthetic bristlets because these kind of brushes less susceptible to the bristlets losing. Paintbrush is a very convenient tool which is perfectly fits for adaptation of material onto the surface of dental tissues. The only drawback of this tool is that paintbrushes aging fastly and lose their original shape, but we just need to occasionally change it to the new one. For this layer, I took another shade of polyethylene enamel from Aesthetics lineup, which is called clear enamel. Paintbrushes may be asepticized in the cold sterilizing liquids, but they will never survive sterilization in autoclave. The last layer in this restoration was OBN from Enamel Plus, which I apply on the cutting third. So the next stage after final polymerization of composite was anatomical contouring and grounding with using of different rotoring instruments. The first tool with which I started process of grounding was enhanced in the shape of a cone. I really like enhanced tips from Dance Placerona company because the abrasiveness of this kind of instruments is sufficient for composite reducing but not enough to harm the enamel edges. On the stage of grinding and polishing with using of all tools that I have, I usually work without water cooling because this approach gives us ability to see how the surfaces change under the influence of our rotoring tools. And this way we can very controllable improve the surface quality. So objections related to the idea of possible sensibility and tooth overheating due to the lack of water cooling are absolutely unfounded. Such problems do not appear if we keep working on a low rotation speed. Usually I use from 10 to 15,000 rotation per minute without strong pressure and with interrupting movements. For improving of side verge position, usually I use discs of a low abrasiveness from 3M lineup. It's necessary to change light direction during the process of finishing. The reason why it's really important is an ability to see the nuances of microrelief only when a glare falls onto composite surface. And if you're walking through the microscope, I advise you to take it away sometimes and look at the teeth without magnification. When we are seeing at the teeth through microscope, our volume perception gets worse. That's why it's better to look sometimes at the teeth surface without magnification. For sidewalls processing, usually I use stripes of different degrees of abrasiveness from 3M lineup once again. The next tool which I use for grounding and surface improving is a special tool from company which is called Joda, tips for composite grounding. This particular tool has many positive qualities. This tool very good centered and very delicate effects to the surface. This tool is perfectly fits not only to improve the surface, but also for carrying a very small and thin morphological elements of the stable surface, for reproducing a very thin grooves, V-shaped grooves, for carving of very small additional ridges, and so on. The process of inner surface grounding of our incisor. Excess in action. With this tool, we can successfully remove excesses of material, especially in the cervical zone, near the soft tissues. The stage of polishing I start from Pogo polishers from Dansply Serona company. This polisher affects the surface of composite very volumetrically and give us quite good preliminary glows. Next tool for polishing is a brush made of a god bristless ghost shiny ass from Material Company. This brush affects a composite surface also very volumetrically, and we can achieve all zones even very hard to reach. The gloss becomes more bright. The last tool on the stage of polishing in my protocol of finishing is polishing paste Prismaglass Extra Fine from Dentsply Sirona Company on a special sponge and metal holder. You can find this holder and sponge also in Enhanced Starting Kit. For the first few seconds, I use this paste without water cooling, and then I start to add small amount of water on my counter-angle handpiece. This is the view of restoration immediately after finishing in the same visit. And these few pictures show us the external view 2 days after finishing and polishing. Well, thanks for your attention, dear colleagues and friends. I hope that this video and my description was useful for you. In the nearest future, I will prepare a few more clinical cases with complicated clinical tasks and with detailed description of all stages. So, see you next time.